So you have a male patient whose background history of ACV presented following a polytrauma. Primary survey was done, and he had blood transfusion and underwent splenectomy as well. Why does the patient have bleeding tendency in that setting?
So this patient specifically has bleeding tendency because they have a past medical history of hepatitis C virus, and therefore they have a deranged liver function. They'd be unable to synthesize vitamin K and therefore factors 2, 7, 9, and 10, protein C and protein S.
Of course, that's very well done. The other thing to mention is that usually any trauma patient will be at high risk of bleeding tendency as well. And that's one of the reasons why for all trauma patients, they will be given tranexamic acid according to ATLS protocol, because they will have sort of coagulopathy due to the stress response of their body. What are the late complications of HCV?
So the late complications of hepatitis C virus would be liver cirrhosis and hepatocellular carcinoma.
And what activates the intrinsic and extrinsic pathway?
So the intrinsic pathway is due to direct vessel injury, and that releases or activates factor 12. And the extrinsic pathway is the release of tissue thromboplastin.
Okay. And how to test the intrinsic and extrinsic pathway?
So the intrinsic pathway we can measure by PT, which is activated partial thromboplastin time, and the extrinsic and common pathway is prothrombin time, PT.
Good. And what are the types of hypersensitivity reactions?
So based on which classification you choose, 4 or 5. The classification for 4 is type 1 hypersensitivity reaction, IG. That's where you get mast cells degranulation. And an example here is anaphylaxis. Type 2 is E. This is cytotoxic. This is where you have the antibody working directly against the antigen. An example could be a blood transfusion. Type 3 is E related. This is your immune complex, such as systemic lupus erythematosus. Type 4 is T cell mediated. This is delayed, so this is typically dermatitis or nickel allergy. And type 5 in some literature is reported as autoimmune, such as Graves' disease.
So I think it's stick to one of them. It's good that you cover both, but stick to one of them. And I think I would go with the 5 type and just stick to one of it. What's the percentage of white blood cells in a packed RBCs?
So this is less than 5 times 10 to the power of 6 cells per liter, I think.
What's the lifespan of an RBCs?
120 days.
What are the tests to do before blood transfusion?
So we do a group and save, we do a blood group, and we do a cross match.
And what is cross matching?
So cross matching is testing the donor cells specifically against the serum of the recipient, and it reduces the risk of hemolysis.
And how is it done?
It's done microscopically in a lab. So typically what happens is you'll have the donor cells and they place some droplets of blood and they look for hemolysis under a microscope.
And what are the antigens that are usually there in cross-matching?
This is antigen A and antigen B.
And what are the effects of prolonged immobility on bone?
So the effects would be reduced mineralization, so you'd get osteoporosis of bone, and then you'd also have reduced mineral density.
And why removal of an infected implant is a must if you have an ongoing infection?
So this is because a infected implant will produce a septic focus and subsequently a biofilm. It will increase virulence of bacteria and therefore will cause a fiery sepsis for the patient.
Good. What is the first test to do in infected wounds?
So I would like to do a wound swab and microbiology culture and sensitivity.
And what is PVL Staph aureus?
PVL Staph aureus stands for Panton Valentine leukocidin. It is a specific type of Staph aureus that secretes a exotoxin, which typically puts pores in the membrane of the cells that it wants to infect, and it is associated with a very virulent strain of MRSA.
Very good. It's a leukocidin, or the PVL. Very high virulence type of Staph aureus, and it can lead to, the way it does this, it creates some pores in the membranes of the infected cells, and this will cause necrosis, and it can lead to necrotic hemorrhagic pneumonia as well. All right, I tried to avoid giving feedback during the scenario. So you were timed, and I think you took about 6.5 minutes, which is great actually for the exam. I think other questions can be added. Sometimes the examiner will be jumping between different scenarios actually. For instance, they could ask you about the intrinsic and extrinsic pathway, They could ask you about hemostasis in general and how does it get activated and what's the pathway, etc. They can talk about warfarin in a scenario like this. With sensitivity reaction, they can ask you a little bit more detail about each one. And they can also talk, for example, about the renal graft failure. And then they would ask you, what is the type of this failure if it happens immediately? And then what is the type if it happens after a week, etc. Right.
Okay.
I think overall it's a good performance. That's really what's needed. You need to get short answers and to the point without trying to explain too much. And also you're not underdoing it. You're just, giving adequate answer without overdoing it. I think overall that was good. Let me see if there was any feedback. It went very well. There isn't anything to add on this part.
The
The other
definition
thing,
of a cross match, that's
yeah,
difficult. Yeah.
the other thing that